carotenoids, which are precursors of vitamin A, and retinoids, which are derivatives structurally similar to vitamin A, have shown antioxidative properties and protective effects against certain cancer types. The anti-cancer effects of one retinoid, called all-trans retinoic acid, have been examined in several studies. The all-trans retinoic acid, either alone or in combination with a drug called rapamycin, stimulated glioblastoma cancer stem cells to change into specialized cells and to slow their movement. Another study found the ATRA disrupted the movement of stem-like glioma cells, and it decreased the production of chemicals that stimulate blood vessel formation. A recent study found the ATRA enhanced the effects of temozolomide on the human glioblastoma cells. The treatment of the human glioblastoma cells with the ATRA, or another retinoid called 13-cis-retinoic acid and isotretinoin, made cells more likely to die when exposed to the chemotherapy drug Taxol. Targetin, a retinoid used to treat lymphoma, inhibited the migration of glioblastoma cells, and it changed the expression of several cancer-related genes towards a more beneficial profile. The compound also killed the tumor cells in a mouse model of glioblastoma. The beneficial effects of retinoids have been explored in clinical trials that enrolled patients with glioblastoma. Isotretinoin has been explored in several studies as a maintenance therapy, intended to help delay the tumor recurrence. The retrospective analysis found patients who were taking the isotretinoin lived on average approximately 25 months without disease progression, compared to an average of approximately 8 months in those who were not taking it. The most common side effect was skin-related. Glioblastoma tumors are well known to eventually become resistant to every chemotherapy drug used to treat them. Since singular pathway inhibition is universally overcome by the glioblastoma cells, there is interest in finding multiple drugs that may be used in combination to simply dampen the growth rather than eradicate the disease. The use of multiple repurposed drugs to simultaneously inhibit many pathways at once is undergoing investigation. These are usually combinations of less toxic drugs that are approved for other processes. An ongoing combination under investigation is called CUSP9, and it uses 9 different drugs to overcome over a dozen pathways of drug resistance to the temozolomide. One combination that's shown encouraging results in animals is known as FTT, fasediol, tranilast, and temozolomide. Fasediol is a vasodilating agent, and it's used for stroke victims, and tranilast is an anti-allergy drug that's approved for use in Asian countries, and it acts on a key inflammatory pathway called TGF-beta. This combination suppressed the tumor growth, and it increased the time of survival more than the temozolomide alone in animals who were given glioblastoma. Clinical studies of this combination are needed before conclusions can be made about its use on humans. The American Cancer Society and the American Brain Tumor Association have several dietary and lifestyle recommendations for cancer patients. Good nutrition can help the patients to manage the side effects of the cancer treatment, maintain the energy, avoid infections, and even fight the disease. In general, the patient's diet should be rich in a variety of vegetables and healthy sources of protein and unsaturated fats. Diets high in colourful fruit and vegetables containing high amounts of phytochemicals. Many of these phytochemicals are broken down by bacteria in the gut to form compounds that can cross the blood-brain barrier and influence neuronal function. One class of phytochemicals, called polyphenols, may confer some protection against the development of the glioma by modulating many of the inflammatory pathways involved in glioma formation and growth. For some patients, an exercise program may improve the mood and the quality of life. The ketogenic diet emphasizes healthy fats and proteins with very little carbohydrate, typically less than 20 grams net carbohydrate daily. This diet is sometimes recommended to reduce the seizure frequency in children and adults with epilepsy, but it may also be helpful in those with glioblastomas because the tumours are known to rely on carbohydrates for energy. A ketogenic diet has been found to control tumour growth and to prolong survival in animal studies. Other studies have found the diet can boost the immune response to the tumour cells and provide benefits when used in combination with other treatments, such as radiation. In humans, the diet leads to lower circulating glucose levels, which is associated with better outcomes in those with glioblastoma, and is generally well tolerated and safe. Blood tests can be used to check how well the diet is reducing the blood glucose levels and increasing the ketone levels. A review of 24 human studies found 42% of the studies suggested there may be a direct anti-tumour effect of the ketogenic diet. Quality of life improvements, including sense of overall well-being, fewer seizures and better neurological function, was more consistently reported. Several Phase 1 and 2 intervention trials have been conducted or are underway to investigate if a ketogenic diet can improve the outcome of people with glioblastoma. Some research has suggested restricting the calorie intake can enhance the effects of the ketogenic diet. In one small study of patients with glioblastoma, only a few participants that lost at least 10% of their body weight derived any benefit from the ketogenic diet. Calorie restriction may be accomplished by reducing the daily intake or by intermittent fasting. However, patients with advanced cancer should work with a nutritional oncologist to ensure they're consuming adequate nutrition. Ketogenic diets may have the dual effect of protecting the normal cells and sensitizing the cancer cells to therapeutic radiation. At the heart of the diet is the production of ketones, which can be used by cells in lieu of glucose to derive energy. One of the primary ketones produced in the body, beta-hydroxybutyrate, functions as a histone deacetylase inhibitor. Aberrant histone deacetylase signaling occurs in several types of cancer, including gliomas. Some research has advocated for more widespread use of this therapy for the glioblastoma. A case report published in 2018 combined many of the emerging treatments and natural agents mentioned in this protocol into a single protocol designed to affect metabolism of the tumour. First, the patient, a 38-year-old male, fasted for 72 hours before surgery. Unfortunately, there was residual tumour on the imaging after surgery. The patient went on to receive the standard care treatment, along with several prescriptive and integrative therapies designed to control the growth of the glioblastoma by inducing cellular stress and withholding preferred energy sources. The interventions included a vitamin and mineral blend, vitamin D 5,000 international units per day, methylfolate 1,000 milligrams per day, epigallocatechin gallate 400 milligrams per day, metformin 1,000 milligrams per day, levetiracetam 1,500 milligrams per day, chloroquine phosphate 150 milligrams per day. The patient also underwent hyperbaric oxygen therapy, 60-minute sessions 5 days a week, at 2.5 times the normal atmospheric pressure. After a 21-day course of a low-calorie ketogenic diet, the patient went on to increase his calories somewhat, but to maintain a reduced calorie ketogenic diet for 9 months. The ketogenic diet was done under the watchful eye of his medical care team. At 24 months, his team published their results. The patient was healthy with excellent quality of life. He lost about 19% of his baseline body weight, and his cancer remained in remission. Coffee and tea have been explored as potential dietary interventions for reducing the risk of developing gliomas. In a large study of patients from 10 European countries, daily intake of 100 millilitres, about half a cup or more of coffee or tea, was associated with a lower risk of developing glioma. The association was slightly stronger in men. This same beneficial effect was reported in another study that examined the intake of coffee and tea in people from the US. This US-based study reported those drinking 5 or more cups of coffee and or tea per day were less likely to develop gliomas than those who drank less than 1 cup per day. Coffee contains many phytochemicals that have anti-cancer effects. One of the most interesting compounds is a polyphenol called chlorogenic acid, and this has been shown to inhibit glioblastoma cell growth in lab studies. Other compounds in coffee include caweol and cafestol, and these have been shown in animals to increase the activity of MGMT, which is commonly silenced in glioblastoma cells. Similarly, one of the compounds found in tea, called EGCG, epigallocatechin gallate, has reversed the silencing of the MGMT in cell culture experiments. The EGCG has also been shown to improve the efficacy of temozolomide in a mouse glioblastoma model. In addition, the EGCG has been shown to reduce invasion, lessen proliferation, and may enhance other therapies such as carmustane. One caveat of green tea is it may interfere with a class of drugs called tyrosine kinase inhibitors, as this was suggested by one study. While some authors have raised valid criticisms of the study, until there's solid evidence refuting the interference with these cancer drugs, high-dose green tea should be taken with caution alongside tyrosine kinase inhibitors, and only under the guidance of an oncologist. For more on cancer, herbs, supplements, or natural treatments, check out my website.